Migraine is a distinct neurological disorder affecting about 12.5% of the population and typically affects women during their reproductive age. Its headache is more severe and usually characterized by a unilateral throbbing headache associated with nausea, vomiting, sensitivity to light, sound, and smell. And this is different from the usual headache, which is also known as tension headache, and this consists of a band-like constriction around the forehead. It's mild to moderate and usually relieved by taking painkillers. The migraine is thought to be mediated through the release of a peptide known as CGRP. And because of this new discovery, treatment has been developed targeted towards the CGRP mechanism and turned out to be a very successful strategy. Migraine can be divided into classical migraine versus common migraine. Classical migraine is preceded by visual aura, which might consist of bright shimmering lights or the center of the visual field is obscured. This might last for half a minute to several minutes. For common migraine, they don't have the visual component, but they would have all the other characteristics of migraine. Second, it comes to the frequency of the headaches. If they have high-frequency episodic headache or chronic migraines, they would have a high number of attacks and would have a severe impact on their activities of daily living. The treatment of migraine can be divided into acute treatment versus preventive treatment. Because migraine is more severe than a usual headache, patient might need a combination of painkillers, including a combination of aspirin, paracetamol, and caffeine to terminate a migraine attack. For more severe cases, they would have to use migraine-specific painkillers, known as triptans as well as triptans, and they are usually prescribed by the doctors. For those with high-frequency episodic headache or chronic migraine, preventive treatment is indicated. This may be using one of the medications from antidepressants, anticonvulsants, or antihypertensives. These are drugs which are borrowed from treatment of other diseases and not specifically targeted towards migraine. The CGRP treatment is a new form of treatment targeted towards migraine. So it can be given by injections or taken orally. Because of its specific action, it has more effectiveness and less in terms of side effects. It also turns out that the compliance to treatment is better compared to the conventional treatment. When the patients start to experience a migraine attack, they should take a painkiller as soon as possible. By the time they develop nausea and vomiting, taking painkillers would not be useful or effective. If they don't have the medicine available, they can take a nap in a dark room that can also help to relieve the headache. By the way, because the migraine can be very severe within a short period of time, it's better to do prevention rather than acute treatment.